It's just such a privilege to be here. And thank you so much for your introduction, Lynn. So I am a doctor in physical therapy. And what really drove me to get that degree is just the love of health and our body's ability to regenerate in a conservative way. And as physical therapists, that's what we do. We use exercise, we use manual therapy, and all kinds of modalities, and try to prevent surgeries. We try to prevent dependence on medications. And this is truly my passion. And so originally, when I went to school, I really got excited about working on balance and strengthening. And that led me to get a specialty in geriatrics, or healthy aging. I believe in preventing, and I believe in fixing the roof while the sun is shining, right? And trying to address things as early as possible, especially when it comes to strength, balance, bone density, and your overall health. And eventually it led me to really realize how fractures are an epidemic, and osteoporosis is a silent disease that many people don't know they have until they get that first DEXA scan at the age of 65. And of course, if you're dealing with a condition like cancer or any other illness that your doctor might expect you to have issues with bone density, you might get diagnosed with osteopenia, osteoporosis earlier. But typically, most of my clients find out right at the time they have osteoporosis without really any warning. And so that really drove me to get very interested in how to address it, and what is the research out there? What does the research say about conservative management? And today is all about really educating you and discussing research and giving you tools and understanding of what you can do to improve bone density and prevent fractures, especially as we all get older. This slide is already what I just mentioned, is that I want you to know you have options. And I believe we're all CEOs of our health. We're ultimately in charge. We know our bodies the best. No doctor really can know as much as we do know about ourselves. And we are our own advocates, and we're part of that healthcare team also, right, when it comes to our own health. And also, just from what I hear from clients, medical doctors don't typically have a lot of time during the visits to explain in detail things like bone density and bone health. Typically, they only have a couple of minutes with you. So as a physical therapist, I'm really passionate in educating and really diving deep into this topic. So we'll spend about 30 minutes just going through the presentation. And then, of course, you're very welcome to ask me questions at the end. So just let's relax and learn together. So exercise is medicine. I'm sure you've heard this before, and I wholeheartedly believe this. Through research and through just common knowledge that exercise is already prescribed for things like diabetes and cardiovascular health and even psychological health. And it is medicine. Our bodies receive that input, and they're able to use it to create better health. The research specifically on cancer is really amazing. Exercise prevents cancer reoccurrence. For example, people who use at least 150 minutes of moderate exercise per week have a 50% reduction in risk of cancer coming back. So I'm not sure if you knew about this, but I found this statistic pretty amazing, just exercising. And 150 minutes a week might seem like a lot. I realize that, especially when you're going through chemo and radiation, the energy levels can really vary. However, just knowing this and maybe striving towards that, that's something you can incorporate and help your body heal. Also, exercise reduces cancer-related mortality by 37%. Exercise is now studied as a treatment for cancer as well. So the first 2 points are really based on observational studies. So they look at people who get the 150 minutes a week, and they then have the statistics. Okay, so this population has better chances of not having cancer reoccur or better survival. but now it's actually studied as a randomized controlled kind of treatment to where they put people in groups, just like medication. So I find that extremely just hopeful, and any natural way to help your body, I feel like it is always a good idea. So 150 minutes of moderate exercise per week. It doesn't have to be anything extreme. Even just walking 2 miles in 30 minutes, that's considered moderate exercise. Biking 5 miles in 30 minutes, swimming laps, dancing, walking stairs. You can accumulate 150 minutes even in 10-minute bouts or 15-minute bouts a couple times a day. So it doesn't have to be an hour 3 times a week. It's really any way you can, you just accumulate it. Exercise benefits are huge, not just musculoskeletally, you improve your strength and balance and muscle mass, but also everything else it does systemically. It regulates our blood glucose, our insulin, oxygen levels. It's great for brain health. So I know someone mentioned, of course, medications and chemo can really create that brain fog, and exercise is a great way to create perfusion in the brain, blood flow, and just something simple like that can be very beneficial. Exercise also regulates estrogen and testosterone, improves lymphatic flow. It helps, it's prescribed as even management of depression and anxiety. 30 minutes, 5 times a week is an actual prescription of exercise. It helps sleep. So no wonder, it's already studied even as a cancer treatment. So, but today, my goal here is to dive deeply into exercise for bone strength. Bones or the skeletal system is a separate system in the body. We know that exercise is often prescribed to muscles and for cardiovascular health, but for bones, it's an entirely different prescription. And the first thing I want you to realize is bone is a living tissue. It has cells inside that work together and precipitate the matrix, and then the matrix attracts calcium and phosphorus, and that process is ongoing throughout our life. So we have osteoclasts, and this is important because I will spend a little bit of time discussing medications and what cells are being affected by medications. So osteoclasts are cells that are responsible for resorbing old fragile bone cells. So for example, if you go and do a power walk or any kind of activity that stresses the bone, it's normal to create little micro-stressed areas through activity. And the job of osteoclasts is to go into those areas and resorb the old insufficient cells. It's a very healthy thing. And osteoblasts, which is the other type of cell, knows then to come over to that area and build a new matrix. So both cells are really necessary for bone density. And that process goes on no matter what throughout our whole life, even in our 80s and 90s and above. So often you'd hear osteoporosis is a calcium deficiency, but it's not true. Unless you're severely malnutritioned and you have that diagnosis of not having enough calcium in your diet and in your blood work, osteoporosis is really, when it comes to just general aging, is deconditioning of the bone. And it can be either primary or secondary. Primary is always related to aging. White and Asian females age 35 and above are most susceptible, and everyone else 65 years and above as well. What happens is up until age 30, we build bone density, and we don't have to engage in really any specific exercise to do that. Our bodies just naturally build the skeletal mass. And then after age 30, it starts to level out. And for men, it stays pretty stable until age 65, and then it can start decreasing. But for females, it can, especially Asian and white females, smaller frame females, the bone density can begin decreasing at 1 to 3% per year, even after age 35. So by the age 55, if someone is healthy and doesn't have any other, conditions, they could still have osteopenia or osteoporosis just due to normal aging process. And I believe it has to do with our lifestyle today. It is more sedentary. We're not farmers like we were, 200 years ago, right? And just our modern lifestyle, the conveniences of it, I believe that it has affected the widespread osteoporosis. Now, there's also secondary osteoporosis, and this is related to usually chemotherapy, radiation, any kind of hormone blocking treatments, thyroid conditions, digestive issues, and other medical conditions. So when it comes to cancer treatments specifically, if they drive your estrogen and testosterone levels down, they typically cause osteoclasts, which are bone resorbing cells, to become more active than they need to be. Estrogen controls osteoclasts and keeps them in balance. So whenever you either are going through menopause or naturally aging or are taking a medication that decreases estrogen, osteoclasts become very active. So they resorb bone very quickly, and osteoblasts are not keeping up. So that is a really special consideration when it comes to cancer treatment, is even for men as well, when testosterone is being suppressed, because that's typically a treatment for cancer, then osteoclasts become more active and the bones lose calcium much faster. Other risk factors, as I mentioned, are being female, smaller skeletal frame and size, going through menopause, of course, smoking, malnutrition, anorexia. And if you have any other medical conditions, such as GERD, for example, heartburn, and you're taking proton pump inhibitors or antacids, even over the counter, they can affect your bone density, even by themselves. That includes also immune system modulating drugs and some other anti-inflammatory drugs. So it's very important to work with your doctor if you're very concerned about your bone density, to look at your entire care plan. Everything that needs to be there, of course, has to stay, but perhaps, if you have another way of managing heartburn, for example, then it would be worth looking into, so you're not tripling your risk and tripling your loss of bone density. So the challenge for someone dealing with cancer is really multifactorial, because you have the estrogen and testosterone deprivation therapies often, you have the radiation and chemotherapy, which slow down all the regenerative abilities of the body. They slow it down, but it doesn't mean that you don't regenerate at all, because bone is a living tissue. So just like your skin regenerates, your muscles regenerate. If you were to cut yourself, you still regenerate. So it's still able to do that, but it is slower. And in conjunction with faster loss because of osteoclastic activity, that's why often many of my clients who survived cancer come back and start managing their bone density right afterwards. And then for women, menopause, a natural decline in estrogen. And for men, usually after 65 or 70, they can start losing bone density due to testosterone loss. And so with aging as well, after age 35, we're just not meant to build any more bone density. So everybody loses bone density. That's just the reality. There are ways you can build bone density, and I will go over that research with you. So stay tuned. So when you go to your doctor, if you're going through cancer therapy or just went through it, and they are concerned about your bone density, often they will, and this was a great question somebody asked over email before my presentation, is they often will prescribe two types of medication. So either bisphosphonates, which are Fosamax, Actonel, Beniva, Riclast, how they work is they cause osteoclastic death. So the cells that resorb, that are being very, very active, are signaled to stop working, and eventually they self-destruct and go away. And this helps prevent excessive loss short term. Then there's Prolia, which is a very common medication, and it has the same end result on osteoclasts, but instead of causing osteoclast death right away. It just blocks the signaling. So those cells don't proliferate to the surface and they are less active as a result. So even though medications can be a good temporary way to manage excessive loss that you're experiencing, it's not a good way to address bone density long-term, because we're still dealing with bone loss related to aging. Even when you're healthy and your treatment works, you're still dealing with just the normal consequence of aging and losing bone loss. And medications chemically disrupt bone remodeling. So you don't actually build a strong architecture. In a way, if you take medications too long, they can actually harm your architecture of the bone. Most of them due to side effects, and just the lifelong effects on the bone can't be taken more than 2 years or 5 years at most. If they're taken for 10 years or above, you would be at risk for more pathological fractures, because that turnover isn't occurring in the bone. So you want the old bone to be removed, because if it just accumulates, even if your scan shows that you have normal bone density or osteopenic bone density, it doesn't mean that structurally it's a strong bone that can withstand a fall or any kind of impact if you were to try a sport or something like that. So it's very important to realize medications aren't a good long-term solution. Also working very close with your doctor when you start to discontinue medications, because some of them can cause a rebound effect. So you stay on a medication for a year or two, and then you discontinue, you can lose almost all of what you gained in the 6 months after you discontinue. So it's very, very important to work close, ask questions, and just do your best when you transition with medications and see what options you have. Sometimes they can put you on a transition medication to help you with that. And then some medications, especially bisphosphonates, have some pretty strong side effects, like osteonecrosis of the jaw and esophageal ulcers, fatigue, and bone pain. So also choosing the right type of administration of the medication. So IV versus oral, for example, taking pills, that can make a big difference. For example, that when you take the pills, they can cause esophageal ulcers. So if you already have GERD or any kind of concerns with your digestive health, IV might be better, or the injection might be better. Osteonecrosis of the jaw is an important side effect, because if you need to have any dental work done, you may want to do it beforehand, because dentists won't work on you if they know you are on a bisphosphonate, for example. So there's a lot to consider. And just encourage you to ask questions from your doctor if they suggest medication for bone density. So what is the alternative? So I've looked into research in the last 10 years. This has been my passion, and it's incredible how far we've come, even just in research when it comes to bone density, even in the last 10 years. And what we know from as early as 1800s, that mechanical loading is very effective for bone density. It's a way to increase bone density when we're younger. If you look at mechanical loading, is any kind of stress you can create on the bone through exercise. So if you look at youth sports, for example, gymnastics, or things like powerlifting, those are typically the children and then the adults that have the highest bone density. Even if they have other issues going on health-wise, they usually never get osteoporosis, because they build a very high peak of bone mass because of engaging in those activities. And then any kind of long-term exercise through life overall is also associated with higher skeletal mass in older adults as well. We know also that astronauts, for example, when they go into space, they lose up to 2% of bone mass per month. Typically, we're supposed to lose maybe 3% a year after age 30, but astronauts or individuals who are on bed rest typically can lose 2% of bone mass in their hip per month. So that's a very huge loss. If you lose, for example, 12 to 15%, it can be the difference between normal bone density and osteopenia and then another 12 to 15% would mean osteoporosis. So mechanical bone stress is a really great solution because if you can incorporate that into your lifestyle, you don't just get to build bone density, but you also get to preserve bone cells. Bone cells are very sensitive to stress. If they don't get stress, what you don't use, you lose. You literally lose those bones. They start creating conditions that cause cellular death within the bone, just because they're not being used. Bone stress or mechanical bone stress through exercise also directs osteoclasts to go into the right areas to absorb the bone that's insufficient. So instead of just going randomly, if somebody isn't very active, they know exactly where to go because you've just stressed an area through activity, and they know, okay, that area is getting weaker. Let's go ahead and remodel it. And you also have stem cells in your bones that are that differentiate into osteoclasts and osteoblasts. And so that stress helps the stem cells to be used throughout your life and not go unused because we're not being active. And finally, osteoblasts, the building bone cells, begin building along the lines of forces. So you can think of it as a bridge. You have a bone structurally has to support forces when you, for example, have to jump or catch yourself, or you're playing a sport and you're lunging side to side. But geometrically, bone has lines of forces. And if you stimulate stress through those lines of forces, you're building and preventing from fractures. So this is why medications aren't a great long-term solution, because all they do is cause osteoclastic death, but they really don't, they actually inhibit building, because when you inhibit resorption, you also inhibit building. So it does not really address the root cause. So through research, even in the last 10 years, in 2004, Surgeon General came out with a statement finally for osteoporosis and bone density. And the reason he came out with this statement is because doctors would often say, okay, you need to do weight-bearing exercises. Go ahead and do walking, or try, if you can, strength training. But there is no prescription when it comes to how much or how much force is necessary. And so finally, this is what the research is about the last 10 years, is they have a prescription of how much you need. And Surgeon General came out with maximal musculoskeletal loading exceeding someone's body weight is required to increase bone density in adults over 35. In 2012 through 2015, there were studies done on adolescents and then premenopausal women and postmenopausal women, measuring stress that they experienced through activities of their choice, like running or jumping. And then they would do a scan of their hip beforehand and then 6 months after. And they would notice that individuals who received 4 times their body weight through their hip, through jumping or powerlifting or weight training, for example, would be the ones who could reverse bone loss, or instead of just stabilizing and not losing anymore, they would actually gain more mass in their bone. So that was very encouraging, because finally we have at least some research that quantifies how much do we need. So, and for bones, what you really need, the 2 types of activities are plyometrics and heavy resistance training. And I realize this, might seem intimidating when you look at it, but information is power, and I'll explain what you can do and where you can start, because it's important to really know the truth and the reality of what needs to be done. If you look at cardiovascular health, for example, you just need to do low impact, get your heart rate up to a certain, and they have that through research, to a certain number, 70% of your heart rate max or 60%. So they have all that quantified, and you can do that 3 times a week to 5 times a week. And then when you look at muscle, if you wanted to gain muscle, then you don't need to do plyometrics necessarily. You just need to start strengthening activities and do that 3 times a week or so. So for bone, they have research now, and it's quantified. You need very heavy resistance training, heavier than you would for regular muscle strengthening. Plyometrics work amazing as well if someone can tolerate them. So things like impact, like jumping, or activities that involve rebounding, but not on a rebounder. It have to be hard surface. And the good thing about it is you only need short bouts. So you don't need to do it multiple times a week. If you look at gymnasts who experience a lot of impact and a lot of strength training, they typically train hours and hours and hours a week, every day. Basically, they train 6 hours, and they experience stress fractures. So when you train at that level, of course, you can sustain injuries to your joints and stress fractures. But if you do short bouts of similar activities like heavy resistance training and plyometric, it creates just enough stress, but not too much, and for you to be able to improve bone density. And once a week, through research, is shown to produce the greatest improvements. So you stimulate that stress once weekly, you allow your bones 5 to 7 days to recover, and then you can do it again. So the biggest takeaway from all the research on bone is, in order to reduce the rate of bone loss, so instead of losing, for example, 3%, to start losing 1%, you can engage in things like power walking, moderate resistance training, dancing, activities that you like that are more of a moderate type of exercise instead of light exercise, right? And also making sure you have sufficient calcium and vitamin D in your diet. It's always better to get it through food. If you have questions, I can always answer more questions about calcium, but it's always better to get it through food to avoid other side effects for heart health and cardiovascular health. But in order to stop the loss completely and actually gain bone density, you want to have strength training at least 80% of your maximum. So through research, we know for the hip, for example, as we discussed, it's 4 times your body weight. And you can achieve that either through strength training or sometimes plyometrics, which I don't recommend plyometrics if you have osteopenia or osteoporosis, just because of the risk of injury and fractures. In the spine, one needs to experience about 2 times their body weight, 2.5, and then upper body is 2 to 2.5 multiples of your body weight. So it's quite a bit of force, but this is what bones really need in order for us to have a chance at improving density. So when you look at activities in multiples of your body weight, for example, swimming would be less than your body weight because you're being supported by water. So wonderful activity, but I just, in terms of discussing bone density, it wouldn't be effective for bone density. Same with cycling, walking, yoga, type of Pilates activities. If it's only 1 of your body weight or less, then you're not really stimulating even the preservation of bone cells. When you go into activities like power walking or heavy resistance training and maybe light jogging or running, you are preserving bone cells. Most likely, if you have osteoporosis, you won't improve with those activities significantly, but you might be able to at least stop it from progressing. And then finally, like I mentioned, through research, we know that gymnastics and powerlifting are the most effective. So different initiatives in the world, and I want to encourage you to explore that, for example, powerlifting for older adults. They're usually done in supervised settings. Form is extremely important because if you have osteoporosis in your spine, your form has to be perfect in order for you to not get injured. Then, of course, there are methods like Pilates and yoga for posture and balance. So even though they wouldn't improve your bone density significantly enough, unless if you go from bed rest, for example, to Pilates and yoga, then you'll have an improvement. But if you're at baseline of just being active and walking and doing daily activities, Pilates and yoga has not been shown to improve bone density. And they've studied this pretty extensively, because if that was the case, then we wouldn't have osteoporosis. The barrier right now is that most people don't feel comfortable picking up something like powerlifting, right? Or impact training. And then finally, if someone already experienced a fracture, or maybe they're at high risk for falling and fracturing, physical therapy is another recommendation. And this is what I used to do or I still do as a physical therapist primarily. Now I focus on prevention and dealing with osteoporosis head on by administering the forces that are necessary. But prior to that, specializing in geriatrics and working with really complex medical conditions in adults over 80 years old, I would be able to work on their balance and maybe fall prevention, but never improve bone density. And now I know why, because after studying what you require, the forces you require is just not something you can do within a physical therapy setting. So when it comes to strength training, it's best to start strength training as soon as your cancer treatment begins, or even before. The only precaution or contraindication, if your platelet count is very low, 50,000 or below, you do not want to do strength training or anything strenuous at that time. But it's very safe to do strength training. And for instance, there are 61 studies that were examined with women with stage 2 breast cancer, and they found that a combination of aerobic and resistance exercise was not only safe, but improved health outcomes. If you have bone metastasize, then what you want to make sure is you consult with your doctor, because it just depends. A bone cancer can produce a fracture if you stress that bone, because it just depends on specifically your condition. So you always want to consult with your doctor about that. And if you're eager to start strength training, I would caution you to start slow. You want to make sure that your form and your biomechanics come first, that you don't just start lifting very heavy weights. You always consult with your doctor that to make sure everything is safe and okay for you to start that, as well as work with a professional. If you're new to strength training, they can guide you through different safe exercises, especially if you have osteoporosis. And they're just going to make sure that all your movements are safe. And then one thing that I wanted to talk to you about today, and I realized that many of us are in different states and different cities, but I have a studio locally, and it's a safe alternative, provides a safe alternative to plyometrics and heavy weightlifting. And we specifically focus on improving bone density, balance, and power. And it's a wellness studio called OsteoStrong. As a physical therapist, I was very interested in the concept right away, and then have done a lot of research, because I'm always interested in conservative management and helping the body heal and use its own resources. It's the best long-term solution for most conditions anyways. And so what it is we use robotic machines, and they might look kind of like gym equipment, but they function completely differently. When you are going through the session with a coach during those machines, it's a more like an isometric activity, which does not have any kind of uncontrolled and unsafe movements. So it's safe for someone with osteoporosis and osteopenia. And also it was designed by a doctor through research and engineering to deliver this osteogenic loading to improve bone density. These centers are available in New York. Someone mentioned Arizona, I believe, North Carolina. And the best thing about these is because they were designed for bone density, this is a 20-minute session once a week. So if you are dealing with energy issues and going through treatment, as long as your doctor okays strength training, you can do this. This routine is very time efficient, and you won't be sore afterwards. It's very gentle on the joints. You're always with a coach, and you can expect your power and strength to improve as well, because you're training your own muscles to produce that force while you're stressing the bone. So as if there was something else available, I would always bring it up, in my educational lectures, but this is something that I got interested in and decided to open because there was nothing else out there. And, most medical doctors don't feel comfortable prescribing powerlifting to people with osteoporosis because there really isn't a great safe way to prescribe something like that and ensure that the patient won't get hurt. So if you wanted to see what, if you were curious, there's a 1 minute video I have for you from a client going through a session, just so you could kind of see what it looks like. So I'm going to play it right now. It's a 50-second video.
Hi, my name is Betty. I'm 74 years old. I was diagnosed with osteoporosis in my 50s. I have not been on any drugs. I am was trying so desperately hard to stay drug-free. And I'm so glad I found OsteoStrong. I've had 1 DEXA scan 6 months later. Not only were my hips out of osteoporosis, but osteopenia. I have suffered from sciatica and piriformis issues for years, and happily, the last several months, I have no issues. I test out to be someone in their 20s for strength and someone in their 30s for balance. When I began, my balance was horrible. I cannot believe how good my balance is and the things I am doing on that little vibrating platform they put you on. I love my coaches. I can't strongly urge everyone to give this a try. Your first appointment is a consultation. You try out machines free of charge.
So let me stop this. So you've kind of seen how it works. It's a static activity. We use visual feedback. It makes it very safe, and it makes you able to engage your muscle fibers better than without visual feedback. And you're put in a position where you're at the strongest leverage as well to be able to receive that stress and for it to be safe on the joints. So as a gift for attending today.
Hi, my name is Betty.
Let me see. I wanted to skip to the next slide here. If you're local, we are offering you a free consultation. We'll sit down with you. A doctor of physical therapy will sit down with you for a whole hour, and there's no obligation to sign up. We just want to help. And if you wanted to sit down with us for an hour and bring your DEXA scans and really explore your own health history when it comes to bone health, we will sit down and answer all your questions truthfully, go over your history. And if you wanted to do that, you can schedule a consultation within the next 24 hours by calling our phone number here. It's 239-989-8010. And we can take you through a session too, as long as there's no contraindications from your doctor. So thank you so much for staying till the end. And I would like to open up now to questions. If you had any questions about what was discussed.